Good day. Today we will talk about the measures of association in epidemiology. Our session objectives. At the end of the session, the students will gain basic concepts of the various measures of association, apply appropriately its use in hypothetical health scenarios, and interpret the results of risk measures and odds ratio. Measures of association measures to compare the rates of a particular disease experienced by people who have been exposed to a risk factor for that disease and those who have not. Example, how much more prevalent is angina among those who smoke than those who do not? The most popular measures of association includes absolute risk, relative risk, odds ratio, attributable risk, and population attributable risk. This table shows a 2 by 2 table example for risk. We have the disease present and the exposed to risk factors. So we have four cells for yes on the disease present and exposed to risk ratio. We have letter B, yes for exposed to risk factor and no for disease present. We have C, no to exposed to risk factor and yes to disease present. And D, no to exposed to risk factor and no to disease present. The 2 by 2 table shows how many patients had a particular disease, that is A plus C. How many did not have the disease, how many were exposed to a particular risk factor, and how many were not exposed to that risk factor. It also shows how many had the disease and were exposed to the risk factor, how many did not have the disease but were exposed to the risk factor, how many had the disease but were not exposed to the risk factor, how many did not have the disease and were not exposed to the risk factor, and the total number of subjects. Absolute risk is the probability of having a disease for those individuals exposed to a risk factor. It is calculated as follows: the number of cases of disease in those exposed over the number of individuals exposed. So in our 2 by 2 table, absolute risk can be calculated as A over A plus B. In the example in table 1, if 90 people were exposed and 20 of them develop a particular disease, their absolute risk is 20 over 90 plus 0.22 or 22%. So this is the calculation of our absolute risk. A over A plus B. Then we have the absolute risk of 22%. That is 20 over 90. Then we have the relative risk, or the RR, indicates the risk of developing a disease in a group of people who were exposed to a risk factor relative to a group who were not exposed to it. It is calculated as follows: disease incidence in exposed group over disease incidence in non-exposed group. If RR is equals to 1, there is no association between the risk factor and the disease. If RR is more than 1, there is an increased risk of developing the disease. If one is exposed to the risk factor, such as for lung disease, which in which the risk factor is smoking. It suggests that exposure to the risk factor may cause a disease. If RR is less than 1, there is a decreased risk of developing the disease. If one is exposed to the risk factor, like colon cancer, and the risk factor is eating fresh fruit and vegetable, it suggests that exposure to the risk factor may protect against the disease. In using our 2x2 table, relative risk can be calculated as A over A plus B divided by C over C plus D. Let us work out a relative risk from a real study. Are women undergoing in vitro fertilization more likely to suffer a miscarriage in the first trimester if they have bacterial vaginosis? Our RR is the proportion of disease in exposed group over the proportion of disease in non-exposed group. So presenting that in our table, a 2x2 table showing miscarriage in first trimester and bacterial vaginosis status for women undergoing in vitro fertilization. So we have the miscarriage in first trimester and the bacterial vaginosis as the risk factor. So our relative risk, A over A plus B, that is 22 over 61, is equals to 0.361 over C plus D, which is 27 over 146, and that is equals to 0.185. So 0.361 divided by 0.185 is equals to 1.95. This study reports that women who are undergoing in vitro fertilization are nearly twice as likely to suffer miscarriage in the first trimester if they have bacterial vaginosis. Attributable risk, or AR, is the excess risk of developing a disease in those who have been exposed to a risk factor compared with those who have not. AR is especially useful for making decisions for individuals. For example, how much more likely is an individual to develop liver cirrhosis if he or she drinks heavily? Attributable risk is calculated as follows. Disease incidence in exposed group over disease incidence in non-exposed group. So in our 2x2 table, that is A over A plus B minus C over C plus D. AR risk of 0 indicates that there is no excessive risk from exposure. So in our example, about the miscarriage in the first trimester to have a bacterial vaginosis, so we have 22 over 61 minus 27 over 146, that is equals to 0.0361 minus 0.185, and that is equals to 0.176. This figure can be multiplied by 1000 to obtain excess number of first trimester miscarriage in women with bacterial vaginosis, which can be attributed to having bacterial vaginosis. That is 176 per 1000 patients. AR should not be calculated for case control studies. Population attributable risk assesses how much of a disease in the population can be attributed to exposure. PAR is essentially the total disease incidence in the population minus the incidence in those who have not been exposed to the risk factor. It can be useful to public health workers in deciding whether to take steps to control spread of disease to which population is exposed. Odds ratio. In case control studies, we retrospectively find people who have already developed a disease and finds controls who do not have the disease but who are otherwise similar. We do not know how many people were exposed to a risk factor for the disease but did not develop it. For this reason, we cannot assume that sample is representative of the true population, hence we will use odds ratio. Odds ratio can be calculated as follows. Odds that subject with disease have been exposed to a risk factor over odds that subjects without disease have been exposed to risk factors. Using a 2 by 2 table, the odds ratio can be calculated as follows. A over C divided by B over D. For example, a table showing breast cancer and greatly life-threatening life events for women aged 20 to 70 years undergoing biopsy for a suspicious breast lesion. At least one greatly threatening life event in the previous 5 years is our risk factor. So for this, is there a relationship between adverse life events and breast cancer? So our odds that the subject with disease have been exposed to a risk factor is 19 over 22 A over C divided by B over D, that is 15 divided by 63. So the answer is 3.63. This study reports that women who have experienced greatly threatening life events in the past 5 years are 3.63 times more likely to develop breast cancer than those who have not. Thank you.